nice to have, believe it or not, an opening that had a religious quality to it. But of course, I'm always thinking that, you know, any way I can show the diocese that God talks to me and anybody who's with me is a good idea in my mind. But David Ames, Reverend David Ames, Reverend Dr. David, our next speaker, has been with this movement in Rhode Island much longer than I have been, and he was already an institution in 1977 when I came to Planned Parenthood. These were the days when the clergy were, for many women, the first line of defense. The first place you would go to hopefully get information, guidance, a referral, support, reassurance that you weren't the most terrible person on earth, whatever. David has been doing that job in one form or another even to this day. Now, even with abortion being legal, I'm sure that the word of his compassion and interest and concern and good advice has been solidified in Rhode Island and beyond. So we're delighted and honored to have him here today to speak to us. David.
Thank you, Mary Ann. One correction, I don't consider myself an institution. I just want to thank everybody. It's an honor to be with you. I'm convinced that the future of women in Rhode Island and across the nation is one to bring all of us greater social justice. And we are all indebted to the women of this country for that dedication. My commitment to reproductive health care began many years ago when I became a college chaplain 2 years before Roe versus Wade. Within 2 weeks of setting up an office on campus, I was asked by a dean to help a student find the necessary funds to terminate her pregnancy. When told she was about 9 weeks pregnant, I realized I had about a week to determine my own position on abortion before responding to the dean. After reading and talking with a few trusted colleagues and friends, I agreed, and I have never looked back. Soon thereafter, I joined the Clergy Consultation Service in Rhode Island and began to offer counseling and support to women experiencing problem pregnancies. The Clergy Consultation Service was founded in the late 1960s in New York City by the Reverend Howard Moody at Justin Memorial Church. In Rhode Island, it was led by the late Charles Baldwin, chaplain at Brown University. We were a small group of clergy and lay members who were able to refer women with problem pregnancies to the Women's Medical Center in Manhattan, or to Park East or Dobbs Ferry hospitals in New York for safe first and second trimester terminations. Many of these women were victims of sexual assault, had health problems, or were economically or psychologically unprepared to carry a fetus to term. It might be difficult for some of you to understand how vulnerable and frightened many of these women were. Those of us who were providing support were also somewhat at risk. This time was the beginning of my interest in reproductive health and in medical ethics. In the early 20th century, Margaret Sanger and others risked everything to awaken our country to acknowledge that women and men are created equally and should enjoy equal rights under the law. For several years, Sanger struggled and helped found the International Committee on Planned Parenthood, which evolved in 1952 into the International Planned Parenthood Federation. Soon thereafter, it became the world's largest non-governmental international women's health, family planning, and birth control organization. This history of Planned Parenthood is important because of its focus on quality reproductive health, responsible sexual behavior, disease prevention, family planning, counseling, and programs directed to young people, both here and abroad. That history is now threatened as never before. To set the context, we are living in a culture filled with anger and fear. This past August, the columnist Charles Blow, in an article in the New York Times, wrote about President Trump and fear. Charles Blow said, and I quote, "Trump's magical mixture is to make being afraid feel like fun. His rallies are a hybrid of concert revelry and combat prep. Trump tells his followers about all things of which they should be afraid, or shouldn't trust, or should hate, and then positions himself as the greatest defense against those things. His supporters roar their approval at their white knight. Fear is the poison-tipped arrow of Trump's quiver. He launches it whenever he needs to change the subject, justify his callousness and racism, or defend himself from critique." End quote. I joined the board of Planned Parenthood of Rhode Island following the passage of Roe versus Wade because of its commitment to quality reproductive health, responsible sexual behavior, family planning counseling, and educational programs for young adolescents. I stand in solidarity with all who are proud of the high quality that Planned Parenthood does with comprehensive reproductive health care. From the moment a person enters the center, she and or he is cared for by professional personnel and moved through the center with solid information, education, counseling support, physical examination, and follow-up care. The center, the education department, community outreach, and administration all work together to provide for the needs of a great number of citizens without social or economic discrimination. There are very few agencies in our communities that are so open and caring. In her new book, The Monarchy of Fear, Martha C. Nussbaum addresses the power dynamics of fear and the emotions of anger, disgust, and envy, as it also examines the toxic brew of sexism and misogyny. Nussbaum says that fear is often mingled with anger, blame, and envy. Fear often blocks rational deliberation, poisons hope, and impedes constructive cooperation for a better future. A chapter on the toxic brew of sexism and misogyny examines the hostility toward women, especially when they assume leadership roles. It is driven by fear envy and includes stories about the delinquent helpmate, women as embodiment, and women as successful competitors. It is important here to distinguish between sexism and misogyny. Sexism is a belief that women are inferior to men and are therefore less fit for a variety of functions. Misogyny, on the other hand, means hatred of women. Nussbaum defines misogyny as a determination to protect entrenched interests. The emotions of fear envy, fear blame, and fear disgust are all related strands of misogyny. The response of Dr. Blasey Ford's statement of her experience of sexual assault is a profound and a clear statement of both sexism and misogyny. Martha Nussbaum then concludes her examination of our political crisis with a chapter on hope, love, and vision. Hope is the opposite of fear. We need to treat the other person as one with a depth of inner life, a point of view on the world, and emotions that are similar to our own. Habits of hope are developed and sustained by love, a generosity of spirit that practices seeing good in others and expecting good things rather than expecting the worst. These are the words and thoughts that can bring an end to sexism and misogyny and give all women the respect, dignity, and freedom that is rightly theirs. So I thank you, and I express my appreciation to the Women's Project, to Planned Parenthood, and to all of you for your commitment in preserving freedom of choice and quality health care for everyone.